If we want to mobilize the radial column, it's helpful to identify where the bones are lying. So what we're going to do is we're going to find the end of the radius by identifying Lister's tubercle. We're going to find the proximal end of the second metacarpal by sliding along its smooth edge, and then we're going to identify the trapezoid, which is in the distal row, and then the scaphoid, which is in the proximal row of the carpal bones. So on our hand that we're going to mobilize, to find Lister's tubercle, I simply slide between the second and third fingers until I land on a bony ridge, which is identifying the distal end of the radius, which is at this level. And what I can do is I can slide then just slightly distally and identify this further edge of the radius. And what you notice is that it is going to be ever so slightly oblique in an angle of about 8 to 10 degrees. Now, that is the distal end of the radius. It actually meets the ulna at the most medial aspect, or I should say the most radial aspect of the ulnar head. So in reality, the distal end of the radius is quite large, but I'm going to be most interested in that part of the radius that's next to the scaphoid, which is going to be just distal to Lister's tubercle. Now, I'm going to identify where the distal border of the carpus is, as indicated by the second metacarpal. If I follow along it, it's easy to trace its width. Good. And then that space between radius and second metacarpal is going to be the zone where we're going to find trapezoid and scaphoid. By dividing this space into 3, I thought I would have different colors. I don't. By dividing the space into 3, I have the distal third, which is going to be where the trapezoid is found, and then the proximal 2/3 are actually where I can find the scaphoid. And the scaphoid has kind of a lima bean shape that takes part of the space between the Lister's tubercle and the distal radial ulnar joint, that space between the radius and the ulna. So here I have second metacarpal, radius, trapezoid, and my scaphoid. To be sure that I have a limitation of motion, I can simply do a very gentle joint play comparing side to side. So what I'm going to do, and in this case, for filming, I'm just going to use the right hand. But in all patient cases, I will always test side-to-side comparison. So the first thing I'm going to do is I'm going to stabilize radius and move the scaphoid in relation to the radius. So it looks like this. I can pick the arm up slightly. I line myself up parallel to the hand. I'm going to use my little finger to place the hand or keep the hand in the resting position. I place my testing thumb on the scaphoid, just distal of Lister's tubercle, and I know that the orientation of the distal end of the radius is going to be in what we call a declined position. So it's going to be in a dorsodistal to palmar proximal direction that I'm going to be testing. Okay, so stabilize the radius, hand on scaphoid, match it from the other side, and I'm going to do a simple back and forth motion oblique line about 5 to 6 times, and then I'm going to give overpressure in each direction. And actually, I would love to show you what that looks like in comparison to the other side. Simply can't resist. So what I'm going to do, find Lister's tubercle. The scaphoid is going to be just distal of that. Match the location on the other side. And here we go. I'm going to go oblique, and I'm going to do a test. And you can actually see that the excursion is larger on the normal side or the non-affected side than it is on the affected side. Good. That means that I can mobilize it safely. All right, so we'll put that hand away. We also want to test trapezoid in relation to scaphoid. Now, trapezoid in relation to scaphoid is a little bit of a different orientation. The trapezoid here sits actually on top of the scaphoid and is at an oblique angle of dorsoproximal to palmar distal. So whereas the radius has about an 8 to 10 degree angle that goes in a dorsodistal to palmar proximal direction, the trapezoid is opposite that. And you'll see that in my testing. Okay, so now I know that the scaphoid is 2/3 of that distance between the metacarpal 2 and the radius. I have the trapezoid from dorsal. I'm going to match its location on the other side. And now what I'm going to do is I'm going to do kind of a 3-dimensional dart thrower's motion of distal, I should say dorsal volar. I'm stabilizing the scaphoid, and I'm making an arc kind of motion which mimics the dart thrower's motion of the wrist. So when we normally extend our wrist, it automatically goes into that dart thrower, and then the release is during flexion. And the trapezoid scaphoid joint is largely responsible for that motion in relation to the midcarpal joint. So this is going to be a very, very important joint to mobilize when we have limitations of flexion or extension. And the reason, if you remember, that we're mobilizing is to unload laxity at the ulnar column of the wrist.